The World Health Organization plans to conduct a polio vaccine campaign in Gaza after the virus was detected in wastewater. The WHO is going to send 1.2 million vaccines to Gaza, with 600,000 of those for children under the age of 8. Now, the first round of vaccinations is scheduled to be rolled out from August the 17th. The WHO has requested a ceasefire on humanitarian grounds to roll out the campaign. Israel's rejected these requests in the past. On July the 21st, Israel's military announced it was going to start vaccinating its soldiers in Gaza against the threat of polio. The WHO says Gaza had a 99% vaccination rate before the war, and that's now dropped to 86%, leaving pockets of children at risk. Hamid Jafari is Director of Polio Eradication for Eastern Mediterranean region at the WHO. He's joining us live from London. Thank you very much indeed for being with us. In the event that Israel doesn't allow for a pause in the fighting to allow this rollout to go ahead, which is on a huge scale, what are you going to do?
So this is going to be a very, if we do not have a ceasefire, and if sufficient freedom of movement of health workers to be able to plan the logistics and operations and actually find all the children and then vaccinate them, if that is not allowed, the risk of this outbreak spreading not only within Gaza but outside of Gaza to other parts of occupied Palestinian territory, Israel, and surrounding countries, the risk, WHO assesses that risk to be very high. And while no cases of paralytic polio have been detected so far, that risk will continue to increase, especially among the youngest children, among infants who have not been consistently getting their vaccination because of the disruption of the service delivery in Gaza.
You were mentioning before that part of the process is obviously simply trying to find people in order to be able to inoculate them. And you said that there are 600,000 of the vaccinations are geared towards children under the age of 8. Do you have the staffing and the facilities to be able to track people down in order to be able to administer the vaccine?
So WHO is working very closely with the Ministry of Health of the occupied Palestinian territory, with UNICEF, with UNRWA, and other partners, humanitarian actors that are on the ground. We obviously can't do this alone. There are health workers on the ground, and then we will need to train the vaccinators who will be going to vaccinate children. And ideally, what we do in a situation of a polio outbreak is to do house-to-house vaccination campaigns. That obviously is elusive in the current situation in Gaza, where children are in shelters, in overcrowded, displaced camps. So we'll have to organize campaigns both through health facilities, through temporary fixed sites, and where possible, go tent to tent or camp to camp. But it's very important that the planning for this, to map where the children are, to move all the vaccines and logistics, and then start vaccinating children so that we can reach everybody, would not only require a ceasefire and cessation of hostilities, it would require a significant freedom of movement, which is very difficult in Gaza right now, given all the heavy checkpoints and the detentions that happen at checkpoints.
You touched a moment ago on the possible outcome in the event that you're not able to carry this vaccination program out. Just elaborate on that for us. How bad could this get?
This, polio is an ongoing public health emergency of international concern under the IHR. So it is a public health emergency wherever polio virus is detected. So it's a public health emergency in Gaza right now. And if it spreads out of Gaza into Israel, into West Bank, it becomes a public health emergency there. Lebanon is at risk, Egypt is at risk, Jordan is at risk, and other countries of the region are at risk. And with travelers, you remember 2 years ago, polio virus was detected in Sewage in London, in New York. So this can spread very fast internationally. And most importantly, it's a direct threat to the children of Gaza, that this can start paralyzing children very, very rapidly.
Hamid Jafari, Director of Polio Eradication for Eastern Mediterranean region at the WHO. Thank you very much indeed for being with us.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.